years of experience, and today I want to share some tips on practice finance mastery, how you can boost your clinic's profits by increasing your efficiency, by hiring great people, and by paying down some debt and start saving for your future. So we're going to talk about that today, and I'm going to give you some tips. My name is Dr. Cary Yurkiw. I started this company, True North Practice Management, to help doctors and therapists with their practice. All aspects of their practice, not just the operation of the practice, but also ways that you can improve your practice. Sometimes new graduates, they're very eager to start practicing, but they don't have a lot of experience. They don't have a lot of training on the business side of running a practice. The current challenge is that expenses are greater than the revenues. So when you start out, this practice model, it does drain your cash flow. It does make you go into more debt. And so it can be kind of stressful because when you're a new graduate, you're a student, you have student loans, and then you are trying to start a practice, or you're working in a group practice, let's say. It can be very stressful with managing the financial part of your practice, as well as just seeing patients too. Just the patient flow, when to tell patients to come back, tests to schedule, treatments. So depending on the type of doctor or therapist you are, it can be challenging. We're going to talk about profit boosters that work. So simple shifts that will have a big impact on your bottom line. So one of them is to reevaluate your pricing. You want to keep up at the minimum with the cost of inflation. And I find a lot of health professionals don't keep up over time. They get complacent. They don't raise their prices. They leave prices the way they were last year. And especially earlier in my career, when there wasn't a lot of inflation, I found a lot of doctors and therapists not really changing their pricing. In the last 5 to 10 years, with greater amounts of inflation, it's very important that you're on top of this, or else you're going to lose some ground. Plus, as you become more experienced and more well-trained, you can charge more. Your service is more valuable. So just a 5% increase can lead to something like a $20,000 gain over the year. It could lead to more depending on the type of service you're providing. Also, you might want to look at bundling membership offers for recurring revenue. So if you have regular patients that are getting multiple services, this is a good thing to do to increase the revenue streams in the practice. And you want to track your profit per visit on a weekly basis. I know a lot of doctors look at their monthly revenue. I like to keep statistics that are weekly in the clinic, because then we can notice subtle changes that are happening due to improvements we're making with the practice. Another thing you can do is streamline your systems. This will save hours and it's going to save dollars. So if your clinic becomes more efficient because of the way patients are getting scheduled, reminders to cut down on no-shows and late appointments, the way you bill, so there's no slippage or lost billing because maybe a service was not billed for properly and you didn't collect on that. And then accounts receivable, if you have outstanding billings to insurance companies, just following up on that and making sure you have staff that are on top of that, that's very important. And we like to use KPIs or statistics to see how we're doing with our practice. We use the KPIs as well with our advertising. So if we're advertising on Google or if we're advertising on Facebook and Instagram, we want to have those KPIs to see how our programs are doing, how we can improve, what kind of results are we getting based on that. I think it's important for doctors and therapists that are owners to schedule an hour each week where you can go over your numbers, and you want the key stakeholders to be involved in that. That could be a spouse, it could be a partner at work, it could be your office manager, but you definitely want time to review your numbers and to discuss, what can you do better? Where are things kind of going wrong, and how to improve on that? So that's very important from a management perspective. You want to delegate low value tasks to others. So whatever staff can do, wherever you can train them, you should have them doing that. And then you can focus on the patient care, only the things that you do best. So that's hard because I think a lot of health professionals and owners of clinics, they're type A personalities, and what happens is they want to do tasks because they feel they do it better than their staff, which results in those doctors and therapists not delegating tasks to their staff, because there's this period of time where you have to train and you have to adjust to some mistakes being made, and maybe it's not done as well as you've done it in the past, whether it's a report or maybe it's some follow-up that's required. Very important that that you are delegating and training staff, which brings up hiring the best people. So you want A players in your practice. You want the best staff, and that can take some time to interview, to train, to make adjustments to your team. But ultimately, in the end, having the best people with you is going to make a big difference in the outcomes of your practice. So 3 traits of A players are coachability. They have to be willing to be coached or trained, taking initiative, and then the alignment of their work with the mission and the vision of the practice. So I think when you look for staff, these are 3 attributes that you should be looking for. A bad hire can lead to lost revenue, low morale. There can be kind of a poor attitude in the practice. It can translate to patients. It can affect the whole team, basically. So you want to be careful not to do that, and to build up a really great team that can really accomplish a lot. I often say 1 + 1 = 3 in the practice. So you get 2 people together working on a specific task, and there's a multiplier effect to that. So if you want a checklist, be happy to offer that to you. You just have to type in the chat checklist, and we will make sure that we follow up with you and get you a hiring checklist that you can use for your own staff. Here's some success stories of doctors and therapists that were feeling run down, kind of burned out, stressed, and we've been able to help them to restore balance. So working with Dr. Cary completely changed the trajectory of my clinic. His systems are simple yet powerful, and they help me cut down my hours while actually increasing revenue. I feel more energized and connected to my work than I have in years. Working with Dr. Cary completely changed the practice, and it's really improved the way our clinic operates. So here you can see 3 success stories of people that really needed some help with their practice and turned things around. Now for VIP access, what you need to do is to type VIP here in the chat, and we'll get you a 12-month Practice Profit Planner that you can use to increase your revenues, decrease your expenses, and ultimately profit from the work you're doing here with me at True North. The next steps for your offers: choose your next level of support. So if you're interested in going to the next level, the VIP level would be next. There's a small upgrade to your ticket price, and that's where you get a replay of the webinar, and you'll get a planner to help you to profit this year. Also, there's 4-week mastermind group coaching program where we're going to implement these strategies and focus and do a deeper dive into these concepts. You can start anytime. It's a 4-week rotation of these topics, so you can jump in this weekend. and the price for that is $319.42. And then there's one-on-one coaching, where we can review your specific situation, the initial coaching session, $214. And then there's a package with 13 weeks of coaching for $2,086. And last, there's an implementation toolkit where we're going to give you a job posting script, an interview scorecard, and an onboarding checklist, and that's $87.40. So if you're interested in those, I'm going to give you the QR code for those services in a minute. If you have any questions, now's the time to ask. So please feel free to ask your questions here in the chat. You can type in the chat. Now, if you're watching the recording or this webinar at a later date, feel free to type in the chat and we'll get back to you and answer your questions. We check our messages on a daily basis. So we'll go back and check the previous webinars, see what messages are popping up, and then respond to them. I would encourage you to grab your VIP upgrade before midnight to unlock your bonuses. And if you want to join our other programs, then you can scan this QR code for our mastermind group. You can scan this QR code for our coaching sessions, and you can scan this QR code for our one-on-one strategy session. Now, spots are limited to 100 people in the mastermind group, and there's 10 coaching slots available. So I would act quickly to get into these programs so you can start immediately. There's some bonus resources available. So I would, within the next 48 hours, sign up for these programs, and you're going to get the bonus checklist that we mentioned in this webinar. I want to thank you for joining me today, and I look forward to seeing you at the mastermind group or the one-on-one coaching sessions soon.